Welcome everybody to the CGHS research webinar sponsored by the Public Health Department in the College of Graduate Health Studies. Today's presenter is Dr. Megan Reutter. She is a dental hygienist and an educator. Her bachelor's degree is in community health and her master's is in dental hygiene. Megan recently completed her doctorate degree in health sciences at A.T. Still University. To pursue her interest in interprofessional collaboration, she coordinated a simulation activity between dental hygiene and nursing students to provide oral care on an intubated simulator. Her passion is educating students and other health professionals on the oral systemic link. Megan lives in rural Illinois with her husband Landon and their daughter Charlotte. And with that, Megan, you should be unmuted.
Unmute. I think I'm ready to go. Thanks, Marcia, for the introduction. As she stated, my name's Megan. And so before I kind of jump into my research component of everything, I'd kind of like to explain the bigger picture of the idea of how I came about doing this for my research. I'm a very firm believer in advancing the roles of the dental hygienist and to address access to care issues and making sure that dental hygienists are part of the primary care team. And every state has a little bit of a different scope of practice as to what dental hygienists are allowed to do. So, for example, some states allow dental hygienists to be Medicaid providers, or they have dental therapists. This is happening in several states. And a dental therapist is basically similar to what a mid-level provider is for the nursing profession in certain states. And this is mid-level providers have been created to address access to care issues. And these mid-level providers can work in non-traditional settings, such as hospitals. So there's a lot of different, responsibilities that hygienists are allowed to do. It just depends on the state. However, unfortunately for us here in Illinois, we still have quite strict guidelines as to what dental hygienists are allowed to do. And so oral care is often neglected in mainstream curricula, and therefore it's just really not addressed in practice. And as we think about social determinants of health, and especially now more than ever during a pandemic at the height of racial injustice, I just really believe that as healthcare professionals, it's our ethical responsibility to figure out ways to address the different needs of our patients. And therefore, by having students participate in an interprofessional activity that focuses on oral health, allows health profession students to learn from one another what their responsibilities and their roles are. And hopefully they can take that knowledge with them and learn about the importance of oral health and how to provide quality oral care on patients. And by doing this, they will be more likely than to do so once they are in practice. And this concept of interprofessionalism to improve patient outcomes is demonstrated in research. So I was thinking about, what I would want to tackle for my applied research project. And I thought, what kind of better way to marry these two of my passions that I have by focusing on the oral systemic link, and then also at the same time doing it in a non-traditional setting to hopefully advance the dental hygiene profession through a simulation activity. You kind of might hear me say IPE throughout this discussion here, and IPE stands for Interprofessional Education. It's kind of a tongue twister, so I might just shorten it and say IPE a little bit. So fortunately, with the buy-in from the nursing program at Parkland College, I was able to kind of piggyback on a simulation activity. And this is what we focused on then, oral care to reduce VAP. And what I measured then was students' attitudes before and after the simulation activity. So I had focused on two main frameworks here. And I'd like to discuss them just a little bit further in depth. And the first is based on the IPE model. And the Interprofessional Education Collaborative defines IPEC as students from 2 or more professions that learn about, from, and with each other to enable effective collaboration and improve health outcomes. And so despite the push for integrating care, as I mentioned earlier, there's still very little oral health content curricula or education that is involved in medical curricula. However, now that accreditation standards are requiring some kind of IPE in curricula, this really creates a perfect opportunity to incorporate oral health, and that way they can get trained to do so as well once they are in practice. The second framework for my simulation activity was then focused around the oral systemic link. And I wanted to choose something, like I said, that could promote our profession. And periodontal disease is a chronic inflammatory condition and shares many of the same inflammatory markers as patients that have diabetes, cardiovascular disease. Periodontal disease increases a patient's risk of strokes. It can also be seen in low birth weight babies, or it can induce low birth weight babies if they have periodontal disease. And I've even seen new research that connects periodontal disease with dementia patients. But aside from the periodontal disease and the chronic disease link, research also demonstrates the importance of good oral care to reduce ventilator-associated pneumonia, or VAP. And this is a type of topic that would work really well in a simulation lab. And VAP is also a leading hospital-acquired infection, which means it really gets the attention of nursing staff. So my hope then was by having hygiene students get to participate in a simulation lab with nursing staff in a so-called, in a hospital setting that is replicated in a simulation. I was hoping that this would open the eyes of nursing students, and so to see that hygienists can work outside of the traditional private practice setting, and also that they could see then the value of having a hygienist as part of the primary care team. So I use this as well to pitch this idea to the nursing and respiratory program directors, and I was really thankful that they were wanting to participate. But like I mentioned earlier, it also benefits them for their programs because it's a way for them to kind of get a check in the box to do their accreditation for the interprofessional education. So after I kind of was looking at my 2 frameworks, then I needed some foundational guidelines to make sure that this was going to be a successful simulation activity for the students. Not only did I want the experience to go well for the students, I wanted it to be valuable time for them. I wanted it to go well partially too for my research, so I got some good results. So the first one that I turned to was the Health Professions Accreditor Collaborative, or HPAC. And this document has 2 main topics that it really focuses on. And they are how to prepare health profession students to work in collaborative teams. And then it also discusses the importance of institutional structure and really emphasizes that it needs to be structured at the top. IPE has to be valued by administrators and all the way down, because otherwise it's going to be really difficult to roll out an IPE curricula. So it really breaks down how to develop, implement, and evaluate quality IPE different approaches. And it was just a great tool to implement quality interprofessional education and also make sure that it would be then sustainable in curriculum. The next guideline that I referred to frequently as well was the IPEC, or the Interprofessional Education Collaborative. And this one really contains the core competencies of IPE. So this was a great resource for me as I was writing the goals and objectives for our curriculum, and especially for the simulation activity. And I want to kind of mention the 4 competencies, and these include values and ethics, roles and responsibilities, interprofessional communication, as well as teams and teamwork. And these competencies then that I found in this document were also what I used then to measure in my survey, which I'll kind of talk about. I don't want to jump too far ahead. I'll mention that later on in my presentation. And then lastly, another reason, as I kind of mentioned, was why I really gravitated toward this project was other states, particularly in Arizona, they are hiring hygienists in hospitals. And so the fact that VAP is a major quality indicator in ICUs, this just seeing what other states are doing really kind of was my main reason as to why I chose this for my research. And instead of trying to reinvent the wheel, if I've seen something that is working in another state, it's nice to expose students to see what is going on in other states, what's working. So that way, hopefully it can kind of, I am a firm believer that if anything is going to really happen, it has to start in education. So this concept was kind of something that I wanted to expose our students to here in Illinois. So for my rationale and significance and diving a little bit deeper specifically into VAP, I'd like to start with a definition of VAP, and it is defined as pneumonia developing in people within 48 hours of intubation. And what happens is, as our mouth always has normal flora and infectious bacteria in our mouth that is kept in check by our innate defense mechanisms. However, in an immunocompromised patient, they will have difficulty fighting off this virulent bacteria. And if oral care is not completed, this bacteria can be aspirated directly into the lungs. Or if a patient, if a staff member is not completing the quality oral care that needs to be done, that virulent bacteria can also grow down the tube, which leads directly into the lungs. It's a direct pathway from the mouth into the lungs. So let's say then a patient has to go under surgery or needs to be intubated for some kind of medical emergency type of situation. Let's say they have periodontal disease. This can certainly increase their chances then of acquiring VAP. And according to the CDC, 50% of adults 30 years and older have some form of periodontal disease, and 70% of adults 65 years and older have periodontal disease. So if a patient is intubated and they have poor oral care and oral hygiene to start off with, this is just another barrier that staff members have to overcome to ensure that they do not acquire VAP while they're in the hospital. So if a patient, let's say they do get VAP, it's not only detrimental to the patient, but also to our healthcare system. The patient's mortality rate doubles, their length of stay in the hospital increases from 4 to 9 days. And for the hospital, it can cost at least $40,000 anytime a patient acquires VAP. So it's definitely an expense for the hospital. And being in the hospital, I have seen now what they call VAP bundles, which is just like, it can be like 6 or 12 toothbrushes that are really nice packets that you can tear off. And each packet has like a mini toothbrush, usually some type of suctioning tool, maybe a foam swab, or it will also include some kind of gel to provide some lubrication then for the patients. So VAP bundles have been wonderful to make sure that care is being done enough times a day, but it doesn't really, no one's really measuring or knows if what that care has been done, how is it quality care? So there's a difference between, yes, it's being done, but is it being done well? So there's a difference there. And this is usually, the difference is because of barriers to care. So they are described as barriers either are contextual or technical. And contextual barriers include time constraints or lack of training, whereas technical barriers describe like oral crowding with tubes or maybe like an aversive response from a patient. And the mouth is a very personal space and can be extremely intimidating to providers, and to do that on someone else. I do it every day. I'm used to it. But if you are a CNA or a nurse or a respiratory therapist, going into someone's very personal space in the oral cavity can be very intimidating. People really don't want to do that. And when I provide in-services at nursing homes for patients, I'm getting a chat here.
Yeah.
Is there Yes, these two articles that kind of demonstrate then where I got my references for this site. Yes, thank you. Sorry, I should have mentioned that earlier. But if a patient does, or if someone does not value oral care themselves, the chances of them doing oral care on someone else is slim to none. And if they don't have the right education, the oral care might not be done. Even if they have the best intentions, we don't know if it's being done correctly. So education is really the important, key factor in making sure that it's done correctly. So the purpose statement of my study was to evaluate the effects of the simulation activity on dental hygiene and nursing students' attitudes regarding interprofessional collaboration. So for some key studies that I was looking at was first the ADEA, or the American Dental Education Association, their monthly bulletin. And I got my idea for the simulation from University of Southern Indiana. And what they were doing was they've had this first started as a simulation activity, and then they actually took it one step further and did it in a clinical rotation in a hospital, which is amazing. And I was able to talk to the lady who kind of spearheaded this, and it takes a lot of effort and coordination and planning and coordination from instructors, and then also getting people at the hospital that are willing to take on these students and to do it with patients. For my research project, I only had about 10 weeks to do all of this. So I thought, well, I can't bite off more than I can chew, but at least I could do this in a simulation activity. So that's kind of where I had gotten my idea here. And the Journal of Dental Education is also a key journal for the dental profession, and they're always talking about advancing the scope of practice and the importance of interprofessional education. So these were really important journals for me, where I was looking at a lot of my background research in. And the picture here on the left is actually the simulation that was going on at Parkland College. We had 3 sessions. And our students in the dental hygiene program, we have never participated in a simulation activity before because we practice everything on each other. So we are each other's guinea pigs. We did not need up until the pandemic. We didn't need any simulation like that. So this was our first time getting exposure to it. And so it was really cool to see how this gal was behind the scenes, and we can see it was a glass, the double-sided glass, so we could see them, but they could not see us. And so she was kind of controlling then the patient here, and when they would code and their respiration and all of those things. So, and you can see on the top screen there, that was, the video of our students. And then the lower screen was what she was using as, kind of like the control panel for the patient. So I think that was really cool. So for my research hypothesis was nursing and dental hygiene students who participate in an interprofessional experience are more likely to have positive attitudes regarding IPC. And so for the methodology of my study, it was a cross-sectional survey design. It was a quantitative study, and I received my IRB approvals from ATSU as well as from Parkland College. And to the right here, you can see my demographic table. And so the key takeaways here are that the respondents were predominantly white females, and they were 29 years old or younger. So for a little bit digging deeper into what this simulation lab involved, I created a PowerPoint for my students, and that really focused on like the epidemiology of VAP, how to provide the proper oral care, and some of the roles and responsibilities of each profession. So that way it was just kind of a background information for our students. So that way when they were going into the activity, they knew what to expect and what to do. So they had to do that before they even went into the lab. So then I sent out an email for students asking for their participation about 2 weeks prior to the very first lab. So it was an email that I had through SurveyMonkey and to do the consent form and everything. And then we had 3 labs. So there were 49 nursing students, and then we have 35 dental hygiene students. So what we did is we kind of divided them into 3 groups and then had them go in at different times to make sure that everyone was able to participate. And then the patient scenario that we had was, this was originally a nursing simulation lab that they already had in place. So when we were talking about, okay, how are we going to make this work? Instead of creating an entirely new simulation, the nursing program already had this lab in place. So that was going to be ventilated. And it was, John Doe. He was 35 years old and was in because he had a meth lab explosion. So he was burned all over his face and his chest. And so it kind of worked out really well too, because with it being a meth lab, then to tie in more so with the oral care, we talked about meth mouth to the nursing students and kind of tied that in of signs, things to look for, what their tissue would look like, what their teeth would look like. Maybe there's a possibility of when they were intubating the patient that one of the anterior teeth had chipped, that could also be aspirated. So that was kind of what we tied in with our simulation in the lab. And it worked out really well because if any of you are educators, and our program is only 2 years. So we cram in a lot in 2 years. So instead of creating an entirely new simulation lab just to do this, we kind of just used what was there and kind of tweaked it a little bit to make it focus on oral care. And then we kind of did it that way. And that way it would be more apt to be sustainable in curriculum. And we can do this again in the future. So for the inclusion criteria, they had to be second-year students. They had to complete both the pre and post survey. I had a convenient sample of 35 dental hygiene and 49 nursing students that were at Parkland College. And for the exclusion criteria, they were obviously first-year students because they were not, they didn't have the knowledge and basis available to do this. If students did not complete an entire survey, whether it was the pre or post survey, they were excluded from my study. And if students only did the pre-survey and not the post, they were also excluded from the study because I really wanted to do that comparison. And so in order to do that comparison, students, when they did the pre-survey, they created they did a unique ID that they punched in. And so that way, when I was looking at my data, then I would match all the ID numbers and look at their pre and post results. So for the survey instrument that I used, I first came across the IPEC competency survey, which stands for Interprofessional Education Competency. So the first original version has 42 items, and it's based on the 4 domains that I mentioned earlier. And then below, you can kind of see the results for the validity of the survey. So I came across this one and was originally going to be using it. I thought, okay, this is what will measure my objectives the best. And then as I was digging a little bit deeper, I found the IPEC Competency Self-Assessment Survey version 3. And this has 16 items. It is also a Likert scale. So 1 was strongly disagree and 5 was strongly agree. And this only had 2 domains. So it focused on the interprofessional interaction domain and the interprofessional values domain. So when I was looking at the surveys and comparing the two, which to use, the original survey had several questions on ethics, and that would be a little bit more applicable if we were doing like a clinical rotation and dealing with a patient. But in a simulation, if they were doing that, would all be kind of hypothetical situations. So that was kind of one downfall as using the original survey. And also, which worked out really to my benefit, was that the version 3 was only 16 items. And if any of you are educators, you also know getting students to complete 42 questions and actually reading through them all is very slim. So it worked out that the version 3 was shorter, so I would probably have more buy-in and participation. And it happened to work out that it was better off to get my measurement for what I was looking for their attitudes anyways. So that is why I chose the version 3. So here is actually just a brief review of the survey that I used. They are all starting off with "I am able to" statements. And so this is what I administered 2 weeks prior to the simulation activity through the SurveyMonkey. And then I also submitted it again once all of the 3 labs were complete. So for the methodology, in my pre-survey, I included the consent form, and it is also where I collected my demographic information. And then in my post-survey, these contained the survey as well as 3 open-ended questions. And they were, what is the most significant lesson you learned from your interprofessional experience? How has this experience influenced your interprofessional role development? And what could we do to improve the experience? So for my statistical analysis test, I did a Shapiro-Wilk test to evaluate the normality, and a Wilcoxon-Stein rank test was done to compare my pre and post survey responses, and then my significance was set at 0.05. So for my results, I had 28 students that completed both the pre and post surveys. My hypothesis was addressed through my survey scores. So what I found was that there was a significant difference between the interprofessional interaction domain. However, there was not a significant difference found in the interprofessional values domain. And I'll kind of talk about why that was in my discussion. And I also calculated my median scores. And so I've got a table right here that you can see. So by looking at, remember I used a Likert scale. So with the pre-survey interaction, it was basically rounded up to a 4, which would be an agree statement. And that was kind of what I found for both of them for the domains. And so by having what I kind of concluded then from my median scores here was that students typically have a high regard for interprofessionalism to begin with. And so I was thankful that I saw an improvement in those results as well. So for the implications of my findings, as I kind of mentioned earlier, that oral care is often undervalued due to barriers in the workplace. This could also be as a result of lack of education. And so this really adds to, or emphasizes the need to include oral health components in interprofessional activities. And the more opportunities that students have to work together, they can gain a mutual respect for each other's professions and really see the ultimate benefit, which is improving our patient outcomes. And so hopefully as students kind of get experience and have positive attitudes about this in education, it will hopefully just improve their collaborative spirit once they are in practice. We often, see and may experience that a lot of education and practice is done in silos, meaning, dentists practice in a dental way and doctors practice in physicians, and there's nursing. And so we really need to kind of break down these barriers and this siloed education and practice. And really, I think that all healthcare clinicians can agree that we are just expected to do more and more. but we are still expected to do it all in the same amount of time. So it's really challenging to be able to complete all of the tasks. And so I think it's just great that we can see, for non-dental professionals, to see how a dental hygienist can contribute to a primary care team and take a load off of the nursing or respiratory or CNA staff when they're in a hospital. And I think that by doing this, it can really push for the movement how we can have a dental hygienist on the primary care team. So for my discussion, it was a study that evaluated the before and after attitudes. And at first, when I was reviewing my results, I was kind of surprised that I had the interprofessional interaction score showed a significant improvement, whereas my interprofessional value score did not. However, when I was going back then reading the research of my version 3 survey, Kelly Lockman, she was someone who was a leader in doing this version 3 survey. She stated that there's actually the two domains are negatively correlated because students then tend to recognize that once they start seeing how difficult it can be to work in teams, that they have a negative correlation between the two. So you usually see one value that goes up and one value tends to go down, and it doesn't matter which one, but I thought that was very interesting. But she also suggested adding open-ended questions to the post-survey, which I did do. And I'd kind of like to share some of the quotes and responses that I got from some of these students, because I think that while the numbers, did show improvement, I think in my research that these open-ended questions are really what brings a lot of depth to these numbers here. So for a response to the first question, which was, what is the most significant lesson you learned from your interprofessional experience? A dental hygiene student commented, I've realized that my job is much more than just educating patients. I hope to attend and be involved in more interprofessional team-based practice in years to come. As I do that, I will need to educate not only my patients, but other healthcare professionals that I am around, and I hope they will do the same for me. And then I had a nursing student share, I believe dental hygienists are a valuable tool that many hospitals are missing out on. While working in the hospital, I can attest that many patients are underserved with relation to oral care, even though there is a high emphasis being put on its completion by management during routine chart audits. I believe this would be solved by the utilization of skilled dental hygienists. So I thought that was just great. A nursing student probably has experience working on the floor and know that oral care is, it's not just a check in the box kind of thing. It really needs to be done properly. My second open-ended question was, how has this experience influenced your professional role development? And a nursing student commented, I have realized that the oral care I provide for my patients that I have been taking for granted is much more important than I realized. Yes, I knew this information, but after participating in this experience, the importance of oral care and the most basic care that you and I do twice a day without thinking is critical and crucial for our patient's condition while in the hospital. And we had debriefing sessions before and after each simulation activity. And I think this was also where a lot of students, there's a lot of learning going on, and students learned about what each profession has to offer. For example, our hygiene students were talking about how we take blood pressure before every appointment. And I think the nursing students were surprised that, that is something that we do. And then in return, our hygiene students, I think, were surprised during the simulation activity to see how much math that they are calculating and how much medication to administer. So I think, it was just very interesting to see for the students to learn about what each role does. You kind of think but getting to actually talk about what we do, I think was a great learning experience for all of our students. And when I was reading through these responses, I was just so excited because it was like, oh, yes, I feel like they got the what I was really hoping for, and the aha moment and the light bulb went off. So that was really exciting for me to be able to read too. And so the last piece of my discussion was where I focused on self-assessment in behavioral change. And so I found this really interesting because as you are probably all aware of, that self-assessment can be associated with biased results in research. And I found some interesting information from what I have here at the bottom of my reference from Bose, Oliveras, and Edson. And they found that knowledge is related to self-assessment. So what they found was that high knowledge individuals actually have a tendency to underrate their knowledge, whereas lower knowledge individuals tend to overrate their knowledge. So how does this kind of tie in with my research? I thought that this was really interesting, but I feel like for my purpose, that this point emphasizes the fact that IPE activities are needed throughout the entire curricula of health professions so that students have that opportunity to develop sufficient self-assessment skills. And this self-assessment is so important to identify any gaps in knowledge that they have, not only while they are in education, but also to develop this skill to figure out what are their gaps in knowledge so they can stay current in practice once they are practicing in their profession. So self-assessment is so important. And so, this is also important to have students figure out, what worked well, what didn't work well. And they found that sufficient and really well self-assessment skills are more likely to produce sustainable behaviors in the future. So for my comparison of findings, in 2004 and 2008, these two studies found, as I kind of mentioned and aligned with my results, that health science students generally have a high regard for interprofessional collaboration. And then the other two studies in 2017 and 2019, I was kind of looking at, similarities with their research as well as mine. They also conducted research based on the IPEC competencies. Their research also demonstrated improvement in attitudes, and they also found that clinical exposure, interprofessional experience, and professional values all influence students' attitudes towards practicing in interprofessional or multidisciplinary teams once they are in practice. So some of my limitations were a low response rate, and I think that this had to do with the timing of the simulation, because we did this in like the last few weeks of the semester, which were great to be able to, students can apply what they learned throughout the entire course or class and apply it at the end. But it was also the end of the semester, so our dental hygiene students were getting ready for finals when I sent out closer to the time of my post survey. And then the nursing students were getting ready to graduate. So I think they're ready, to like peace out at the end. So I think that's why I had such a lower post-survey response. And then another limitation to my study is that it was only the scores of one activity, whereas my results would be more valid and more reliable if I was able to just measure this of multiple activities over an entire curricula. And then, as I mentioned earlier, there's also always bias in self-reported data. And I did not find any other studies that used specifically the version 3 survey form version. There were several that had the original content, but I didn't find any with the version 3. And then there were some scheduling conflicts. So you might have caught earlier too, I only had nursing and dental hygiene students, but originally I did have the respiratory students that were supposed to be involved. But as we got closer to the simulation activity, it was once again conflicting schedules, which is probably one of the biggest barriers that you will find in trying to coordinate something like this. So the respiratory program was kind of had to bow out because of a scheduling conflict. So my recommendations for future research was to do a true mixed methods approach. And while I had the open-ended responses, I didn't do any themes or anything like that. And it would also be beneficial to advance the simulation to a clinical rotation like they are doing at University of Southern Indiana. It would also be beneficial to evaluate multiple activities across curriculum. And also it's important to consider faculty calibration because you will have multiple instructors that can participate in this experience. And so we want to make sure that our students have a consistent experience as well. So faculty calibration would also be something to consider for future research. So in conclusion, interprofessional education activities serve as an excellent opportunity to, one, meet accreditation standards, but more importantly, allow for oral health education to take precedence in medical curricula. And by learning what each profession does and has to offer, I think that this will encourage professions to start working together once they are in practice, and hopefully encourage a dental hygienist to be seen outside of our traditional role in a private practice. And I really like these two pictures here. The one on the right is actually one of our dental hygiene students doing chest compressions when the patient was coding. And so we kind of said to our patients, or to our students, when you're in a hospital setting, if a patient codes and you are certified to do CPR, it's all hands on deck. So we had all of our students, our hygiene students, that took turns doing the chest compressions for the nursing students. And then on the left here, we have some of our dental hygiene students that got to see a patient get intubated. So that was something that we would obviously never get to see in our curricula and education. So it was great that we would kind of, be in mode of the simulation activity, and then we would kind of stop and pause for a minute to have, a discussion or a teaching moment, or to explain the rationale of why we were doing something. So it was a lot of kind of stop and go for the activity, but it was also a lot of great learning going on. And for the quote that I have here in the center, I think this was just kind of a great blanket statement is, everyone works very hard in their profession, and not to take anyone for granted. So I felt like that was just a really great quote that kind of just was a encompassing statement of what the point I wanted to get across for my research. So and then I also have here my references at the end. So that concludes my discussion. So if you have any questions, I am certainly happy to answer any of those the best I can.
Yeah, if anybody has any questions, please feel free to unmute yourself and butt in. Greg?
Hey, Megan. It's
Hi.
Greg Logan. Nice job on that presentation, and the project sounds interesting. I was curious about your thoughts. You mentioned the types of bias that might have impacted your results. I was curious if you thought self-selection was one of them. So backing up a little before that, you said that you basically sent the initial request to 34 or 35 dental hygiene students and 49 nursing students. And then you said that you got 28 who completed both the pre and post. So I'm curious more about those numbers. How many said they wanted to do it and then dropped out partway through? Was it more than the 28? And then second, do you think that it also seemed like there was a certain homogeneity to the participants, age range, female, white, and then third, and I think all of these are linked, the self-selection bias, people who already had a certain attitude about interprofessional collaboration. You did mention that students tend to view it in a positive light to start with, but maybe even more so people who chose to participate.
Certainly. So what we did, I had a convenient sample. There's 35 students in the hygiene program and 49 students in the nursing program. So that's kind of where I got started off with those numbers. And they all have to participate in this lab. So that was kind of where I just sent that email out to all of the students because they all had participated. So they all had an opportunity to participate in the study as well. So I think the reason why, like I said, why I had the lower response rate was just because at the timing of the simulation activity, because it was at the end of the semester. Now, as far as the respondents, how they're predominantly female, I think this is just because this is what we usually see in the dental hygiene and nursing. Well, not necessarily nursing. There's certainly more of multicultural background in nursing, but we see in the dental hygiene profession, it is typically predominantly female. And we are starting to see more of a wide variety of, cultures that are coming that participate and are becoming hygienists. But I think that's probably the most contributing factor as to why it kind of looks like my results are biased a little bit by having white young females, because that's typically the type of student that we see going into these professions.
So if I could, I'm not really looking for an explanation of why you had that homogeneous group, because I think your explanation is correct. It's pretty straightforward. I'm really interested in your interpretation of how these things may have influenced the results, if you think it did at all, or maybe not.
Oh, okay. I'm sorry.
No?
That's a good question. I would say yes. I mean, that probably does also influence my results for the attitudes and responses that I received. Um, I don't necessarily have an example or, correlation, but I do think that probably, yeah, would influence my response rate and results that I did receive.
It seems to me that you did a nice job of designing the project. And so if you're looking for limitations to it, I would be curious, and it would be kind of hard to figure out, are there relevant differences between males and females, between cultural groups, between other variables that would have been harder to parse out, would have required larger numbers and a more diverse population?
Sure, absolutely. I was actually just participating, and Kelly Lockman, who I did my research with, or got my survey from, I contacted her and asked her if I could use her survey instrument. And she is a member of the AIHC, the American Interprofessional Health Collaborative. And it's a wonderful organization. We just had a month-long conference talking all about different types of collaboration and what activities that these universities and schools are doing. And it would be extremely interesting to research the difference between males and females. And, they even, before they even start an interprofessional activity, they talk about how to break down, they talk about biases of certain professions and groups and things that we have that we don't even realize. So, I mean, there's just an entire realm of interprofessional activities and education that we have to work through. But I think kind of talking about professional biases, and if any of you are in the healthcare field, you can kind of, the stereotypes that we have for certain professions. I think that certainly plays into whether people are willing to work in multidisciplinary teams, if they enjoy it or not. I mean, I think that certainly is an influential factor.
Yeah, thank you.
Yeah, to kind of follow up on Greg's questions, one of the things that kind of struck me about doing a pre and post test using just the Likert scales is, it seems to me, if I'm thinking about how I might respond as a student, and it was occurring to me that you don't know what you don't know. So going in, I might have had positive attitudes, but not really known how much I would really get out of it. And whereas post, I might like, oh, wow, this was like more than I really realized. But it might not necessarily reflect on an increase in score if I already had a positive attitude going in. And so I was glad that you had the open-ended questions as well to parse that out.
Yeah, I think I kind of had a feeling that I would get, a lot of times when even students complete, the end of survey or end of semester survey results, it's agree. It's like they don't even really read the questions sometimes. So I kind of had a feeling that I would get a general high regard. I know in our dental hygiene program, we certainly emphasize, the importance of, working in non-traditional settings, the opportunities that hygienists can work in, different professions and who to partner with. And so we talk about that a lot in our program, but I think that's just the culture of our program. Maybe not necessarily, it might not be such an emphasis in other programs. I don't know. So I kind of had a feeling that I would get a high regard from our hygiene students, but I don't know what they show and talk about in other nursing programs. But I feel like definitely in my research, those open-ended questions were what really gave a true picture of to give some depth to those numbers, because otherwise I mean, if just looking at those numbers, it's kind of flat.
Mm-hmm. Yeah.
So you really need those responses to kind of, give a bigger picture and a better idea of what they thought.
Mm-hmm. Yeah. Okay. Does anybody else have any questions or comments that they would like to jump in with?
Hey, this is Patrick. I've got a question real quick. I'd like to know what your thought. I'm very familiar with the nursing literature in regard to this topic, but I'm not as familiar with some of the external literature. And I'd like to know your comments about the application of these scenarios and these types of studies in terms of the real world practice, because I've been reading some literature recently about the fact that there's concerns because these scenarios are very sterile, they don't involve a lot of the dynamics, for example, with abusive behaviors and environments that are very difficult for having this type of collaboration, that the students are not prepared to manage that in the real world. And I'm just curious about your perspective, since you're immersed in this literature.
So I want to make sure I'm answering your question correctly. So you want to know, how does a simulation activity kind of transfer then to the real world? Is that?
Yeah, because I'm very familiar with these instruments. I know the author of the instrument, and I'm just wondering more about the application, because we're taking these surveys in a sterile environment, but we're not giving the students any anti-collaborative behaviors. So my question is, how do you parse out the concept, which is this collaboration, right? When in fact we're not doing anything to challenge that or to hinder that from happening in the scenarios.
So I kind of feel like a lot of activities prior to even doing something about what I did for my research is you can work on like teams and teamwork, and each interprofessional activity needs to have some kind of main goal and objective. Are you focusing on, mine mostly here focused, on the attitudes, not necessarily of doing the oral care correctly. Are you wanting to focus on, the collaboration, the collaborative spirit, or are you focusing on the actual care? So I feel like if students get some kind of exposure to it in education, that yes, they'll be more likely to do it. But I feel like we're always exposed to things in education, and then you kind of take what you learn and your values, and then you take it with you. And you always experience, like, my sister's a nurse. She says, you're thrown to the wolves, when you get out into the real world kind of thing. But I feel like if you have some kind of foundation, that helps. And I feel, it's just kind of where I really feel like self-assessment and knowing your professional values that we talk about and that we can bring up in these debriefing sessions are things where students can at least learn how to maybe cope with an adverse situation in practice. I mean, what are your thoughts?
No, that's fine. I've been thinking a lot about, having, with these assessments, there probably would be a remarkable difference when students are actually challenged with some anti-collaborative techniques in a scenario where we really clash them. And then there's another scenario later where it's all copacetic and kumbaya. You know what I mean? And I think that's why I was asking that question. I think one of the reasons why maybe sometimes these surveys are not capturing maybe what we're looking for is because I'm not sure the students really are aware of why we're so focused on this concept, and the realities of the environment in which they're going to work in.
I completely agree. I mean, if I were to send this survey out to, practicing health professionals, I'd probably get a really low response rate because, because some of them, I think I would just have very different results because you kind of get exposed and you have lived a little bit, I guess, and it can easily put a bad taste in your mouth. And so, yeah, I agree. I think that during these debriefing sessions, when we talk with our students, about how difficult it can be to work not only in our teams and our own profession, to work with other hygienists, or maybe in the nursing to have nurses work with other nurses, it's even more difficult to work with someone outside of your profession.
Yeah, I just want to say, Patrick, that was a good line of discussion there, because I think I was leaning towards that in some ways as well. How much does this really show us? On the one hand, I don't want to say something like this isn't valuable, because we don't want to just throw students into a worst case scenario and say, see, look how shitty this is. Now what do you think of it? Right? But there is some value to like broadening the way we do these studies. And also, if you're asking them something like, having had this experience, do you think it's good for patients to have interprofessional teams? They might say yes. If you say, do you think it works well? Do you think the system is, conducive to it? Do you enjoy it? They might say no, or,
Well, yeah.
different
I
answers.
mean, when you have a medical problem, you feel like you're just doing the complete runaround and you don't know where to go, who to call, who to get the referral from. I mean, we have electronic health records that are supposed to help with all this continuity of care, but does that really help? Sometimes yes, sometimes no.
Well, you're
I
looking
think,
at a piece of a big puzzle.
Mm-hmm.
see, I think what I was going to say to you about this concept is, it's been going through my mind for the last couple of years, actually, is scaffolding. Because I'm in the process of translating this instrument, by the way, for use in Latin America. And I've been about the concept of scaffolding for developing like scenarios where students can, maybe you can develop this critical thinking and analysis where they see these bad behaviors, because you interject them into scenarios gently in the beginning, so they learn how to manage the disruptive physician, for example, or the nurse who's very authoritative. You know what I mean? So, and that's my point too. So this is not a critical comment or conversation. I'm more trying to understand what I think based upon your immersion in this literature and actually being involved in doing active research in this area.
And I feel like, something they've even said too, and we were talking at the conference, to even just have, you don't necessarily have to have an activity for everything, even if it just includes a discussion board for nursing, respiratory hygiene students, to just kind of maybe give them some kind of scenario. And then, they could read each student's responses and how would they handle it, and kind of, and then at the end, maybe kind of get the group together, or have some kind of instructor that's moderating this kind of conversation, because that is probably going to be the best way, realistically, and in a safe environment, that you could probably talk about how to combat difficult situations like this.
Thank you, Megan.
Thank you.
Guys, I appreciate it. Thanks for coming.
Bye, guys.
Yeah, thank you, Megan. It was very instructional. Okay.
Right. I'm going to try and figure out how to stop my screen sharing here.
Okay.